Dr. Jason Helliwell, and I'm doing a video consultation today for you to view prior to seeing me in person for your in-person consultation. And today I'm going to be talking about tummy tuck, or a minimal invasive tummy tuck called lipoabdominoplasty. The point of this video is so that we can give you information prior to your consult, so that you will have the information to ask more questions if needed and have a better consult experience. The minimal invasive tummy tuck, or another word for it, is called lipoabdominoplasty. Involves liposuction as well as skin excision. And the point, or the reason for doing this procedure, is to reduce excessive abdominal fat and skin. So if you have loose skin and excessive fat in the upper, lower, and flanks of your abdomen, then this is possibly a good procedure for you. During your personal consultation, I will personally examine you and tell you whether you are a good candidate for this or not. This procedure is done under local anesthesia here at Advanced Women's Health Center. It's a type of local anesthesia called tumescent anesthesia, where fluid is infiltrated or infused in your abdomen, and you do not completely go to sleep. You are given an IV and medication in the IV to help relax you and calm your nerves, but you don't go completely to sleep. That means during the time of infiltrating the area of your tummy with the local anesthesia, you may feel some pinches or pokes. These are generally thought to be very mild in nature and on the scale of like getting a shot. This does not last very long, and only a few minutes, and then after that the procedure is begun. First the liposuction is performed, and then the skin excision is performed after that. The entire procedure takes about 2.5 hours, and you will go home the same day. You won't need any drains placed in, surgical drains. You will have a abdominal binder placed on the incision, and you will come back 2 days later. The first 2 days you'll be experiencing leakage of fluid, and this is normal. This is the fluid that we infuse in you to numb the area, and it may be slightly bloody. This is normal as long as it looks somewhat Kool-Aid color in nature, and we tell patients that is normal and not to worry. That is all the fluid that needs to come out after the procedure that is placed in. It generally stops after about 2 days. The rest of the time after that, fluid still remains in the abdomen, and it takes several months, sometimes 3 to 6 months, for all of the fluid and inflammation to be absorbed. So I always tell patients to expect the final cosmetic results can be in the range of 6 months, even to 9 months, because of fluid and inflammation, as well as the healing of the scar. Another risk factor that is involved, another set of risks that is involved with this procedure include imperfect results. I always tell patients that we do shoot for perfection, but we can't guarantee perfect results. So there could be areas that may not be perfect, and when I examine you personally, I will tell you the expectations, and usually in a percentage form, that you can expect with this procedure. It does depend on your body type and other factors. Some people do get better results than others, and results do vary. Some of the results that may be imperfect could be the scar may not be perfectly straight. It may be slightly higher than you might like. Not enough fat may be removed, in your opinion. If any of these do occur, I am always open to discussing with me and your postoperative visits, and sometimes a touch-up may be required. Other than that, there are other risks to the surgery, such as infection and bleeding. These are all thought to be very minimal, including, because we do take precautions, such as including giving IV medication, antibiotics, and oral antibiotics before and after, and also wrapping your abdomen tightly with the bandage and the garment. The garment needs to be on for approximately 1 month, and this will also help with swelling and bleeding problems. We think that bleeding infection is less than 1% chance. Other than that, I believe this is an excellent procedure to reduce excessive abdominal fat and skin that is not amenable to diet and exercise, and for many patients this is an excellent choice. When I see you personally, I will give you the expectations of what you can expect, but I believe this will be a good procedure for most patients that have come here today and watching this video. The other aspect I want to discuss is the recovery. Recovery lasts, as is expected, if you have an office job, can be 1 week. If you have a more active job, we recommend that you take 2 weeks off. After that, we do recommend that you take it easy for a month. You may have off and on pains or little discomforts for a month, which can be amended by taking Tylenol or Motrin or Advil. And then once again, final cosmetic results approximately 6 to 9 months. We do recommend that you don't perform any aggressive exercises within the first month, only mild walking, and no swimming, jacuzzis, or bathtubs, only showers. I look forward to meeting you, and thank you for coming today.